So I actually have had Magnosphere for 1 month, about 1 month and few days. And I have few stories from my patients, but I think what had made most impact and how I got Magnosphere was sitting in it myself in the place where it was a spa convention. It was crowded and it was not very great environment, but what it did for me was amazing. And where I came from, I did my pre-doctoral internship in a forensic psychiatric hospital, maximum security. My background was forensic, so I was really working mainly with people that committed some type of, or were charged with some type of crime, and either they were mentally ill and they were not competent to proceed to trial, so we had them in the hospital to get them to that point with lots of medication, usually, or they were pretending that they were mentally ill, or about 20% of the patients were not guilty by reason of insanity, so they were pretty much sitting on heavy doses of medication for a very long time, or just switched from one hospital to another. What my first day when I was actually taking the tour of the hospital and starting my internship, it was quite scary. We were supposed to have a hurricane, so outside it was quite stormy and rainy, and inside there was quite a lot of noises coming out as we were crossing the hallways with a patient that was actually full on blood, trying to bite through isolated room with windows and screaming that one of us will be the next one he will kill. Later on to find out that he was actually one of the patients that was not guilty of for a reason of insanity and had killed multiple people, including people in a hospital, not the one that I was in. So that was pretty scary start. I ended up, my rotation was in a female unit, which majority of staff were actually very afraid to be on, and they thought that it was better to work with the males than females. But with a lot of compassion, I really actually enjoyed, along with great staff, psychiatrists, working with these females, and saw a lot of trauma with these women, and really got to enjoy the work. However, in the same time, there was every single day where there was some sort of attack, patient to patient, or staff to patient, or patient to staff, and it kind of started to wear on me. It got to a point where I needed to go on my next rotation in a male unit, and I got to be asked the first day I was in the male unit doing evaluations if I wrote a report to the court that this particular male was competent. I said no, and I left, and I needed to come back. And I'm very on track, and I never, ever do something late. But something was telling me that I shouldn't go to that unit. And a colleague of mine who was a postdoc that day got brutally injured. She could have died. I got to see the incident. I was behind 2 glass windows. There was nothing I could do. And even though I have years of psychology and studying, and in theory knew everything about PTSD, I couldn't help myself. And how I explain PTSD or any trauma is, or I really say to people, is when you perceive a danger where there is none. And a lot of people suffer that. So for instance, in this room, if I would ask, is there any danger right now in this room? Majority of people will start thinking about what could possibly happen in this room, but it's really not happening, right? So we're already putting our sympathetic nervous system up, right? So I was walking around, I was not sleeping, I was seeing this incident and other incidents every day, every night. I became a fighter for the whole hospital and wanted things changed. I was asking for more security. We were back and forth with the corporate. They were not willing to do anything. At the end, our universities pulled all the interns out of the hospital. But I was still walking around. I couldn't have people walking behind my back, around me. There was constantly, I was in the state of, perceiving danger. And when I went to Miami and sit in Magnesphere and actually talked to Steve for quite some time and wasn't really sure how could this even work, after the 1 hour, it made such a tremendous difference for me that I decided I don't really care if I use it for any patients or not. I have to have it just for me, for my family, and then I have to have it for any of my patients. And it has done wonders for me, and I really believe in it, and I think that anything that I do, I really research very well. And this was probably one of the things that I researched the least before I got it. But I think it's just in how it functions, it's amazing. Because like Eric mentioned, with the people that don't like to be touched because of their trauma that they experienced, there's also a lot of people that don't like to talk. And we also know that even if people who suffer PTSD and veterans, and if they come for therapy and they're not in relaxed state and they're going through the process, they're just gonna get re-traumatized even more. And for that very reason, I love Magnesphere, because none of that needs to happen. It's happening automatically, and I know that they are in a relaxed state. And so, thank you. Thank you, Steve. Thank you, Dr. Jacobson, and thank you all that make this possible for people around us.